Kentuckiana area, more than 1,000 children are adopted every year from overseas.
Yeah, and with this new little blessing can often come some medical issues that require some expert medical help. Medical reporter Lori Lyle is here to say that help is now easy, accessible.
It's so important to parents because, you know, for years local families have traveled to Indianapolis or Cincinnati over to Lexington to get often required medical assessments from international adoption specialists. But now they can save the travel for the actual adoption. At U of L's new International Adoption Clinic, the stories are as varied as the children families adopt.
At a very early age, I felt led to adopt, and Sarah felt the same way.
Even with two biological, healthy boys, one picture the Stewarts couldn't erase.
Everybody remembers those videos and commercials of the children with the flies on their faces and the emancipation in their bodies and just the tiny little babies crying.
So now that it's time for their girl, she's waiting in Ethiopia.
You know, she's able to find the little toy and reach for it. Now, so at least we have some, we know we have some degree of vision. But
U of L pediatrician Mike Howard is reviewing videotape of Sarah and Chris's newest edition.
She's walking with support.
Okay, well, that's a good sign then.
They can't share the video with us until the adoption is complete, but doctors are not only allowed that privilege.
I don't know about every agency, but I know with our agency, they require that you have the medical records that you get when you first are matched with a child to be seen by an international pediatrician.
And the clinic helps families throughout.
We have to worry about things like fetal alcohol syndrome, nutritional aspects of the mother, and then, of course, institutionalized care can delay a child's growth and development.
For every 3 months in an institution, development can be delayed a month. Often, they can advise parents what to do at home.
We're not here to try and tell a parent, oh, you should adopt this child, you should not adopt that child. I want to make that very clear.
Instead, it's about preparation.
In our case, there is a slight medical problem with vision. Probably just minor correctable.
Whatever they face, their hearts know there is no turning back.
To get the video, to see her face, to know her name, to know that she's actually out there is incredible.
Now they should have her in their arms sometime this fall, and the clinic will then do extensive blood work and assessments in person with specialists from infectious disease to speech pathologist available. It's open Tuesday afternoons by appointment, and insurance covers most costs once the child is here. You may have some out-of-pocket expense before the actual adoption, a couple of $100s.
Maybe one less thing to worry about as a new parent anyway.
Yeah, it helps.
That's good news. Thanks, Lori.
Sure.